but why? Why is this child not developing speech and language? They're in a great environment. Their parents are doing all of the things that they're supposed to be doing. They've gone to therapies for, years. And just why isn't this happening for them? Children who are nonverbal and autistic really have a big deficit in their right hemisphere because they have those issues with those nonverbal communication skills. And that's actually one of the DSM-5 criteria for diagnosing autism because it is a social communication issue. Knowing where your body is in space. So thinking about knowing where your teeth, your tongue, your lips, your jaw, all of that, your soft and hard palate, where they are in your oral structure, but then also like what your body parts are doing at any given time. So like how they're moving to create speech sounds, or how they're moving to create a smile or a frown, like being aware of where your body is in space and what your body is doing at any given time.
Welcome to our podcast. Today we have a special guest, my friend Angela Clark, a successful speech and language pathologist and a Melillo method certified therapist from Florida. Angela has dedicated her career to helping children and adults overcome speech and language challenges using innovative techniques and personalized care, with a wealth of experience and a passion for making a difference. Angela joined us to share her insights, stories, and practical advice for anyone navigating the world of speech and language development. I'm thrilled to have you, Angela, with us.
I'm thrilled to be here. It's been a long time coming, so I'm excited.
Exactly. So, Angela, could you tell us how did you get involved in the field of reflex integration and brain balancing modalities?
Sure. Well, I've been a speech language pathologist for about 25 years, and about 3 years ago, I just started to really think about what it is that I was doing as a therapist and whether or not I was seeing the levels of progress that I should be seeing in my clients based on the amount of work that I was putting in. So I've predominantly seen minimally speaking, nonverbal, whatever the political correct term is these days for kiddos with autism that are not or autistic kids that are not speaking. So that's been the predominant caseload that I've had for the last 25 years. I've also seen children with a wide range of speech and language development disorders. But at the end of the day, I just felt that I wasn't seeing the level of progress that I would have wanted to see for these kiddos. I wasn't seeing the language and the verbal communication expand like I would have hoped and like the parents would have wanted me to. So honestly, I just always say that it was like a divine connection because I really had no grid for reflex integration or balancing the brain. It was not something that we were taught in our field of speech and language pathology. And so I somehow divinely got connected to a YouTube video of Dr. Melillo. And as I watched it, I just really felt like, this has got to be it. This is a missing piece. So I bought his book, Disconnected Kids. I read the book, just read it really quickly. I'm not really that fast of a reader. So for me to read a book really quickly was like, this has got to be good. So, and then of course I went, scouring the internet, trying to find anything else I could about Dr. Melillo and this method. And so I found that he was doing a training out in Texas, and I signed myself up and started going to Texas for about 13 months. I flew back and forth from Florida and trained with Dr. Melillo and some other amazing doctors and functional neurologists that were, out there. And it was just life changing. It completely transformed the way that I see speech and language and what functional speech and language is. So, at this point, I would describe if a child has functional speech and language for their age, they have a really well integrated, well regulated, mature neurological system. And before I wasn't really taught that in my graduate program. So we were using a lot of top-down strategies. And now, having learned these bottom-up strategies from Dr. Melillo, it just makes so much sense when I would, look at all of these cases and feel like, but why? Why is this child not developing speech and language? They're in a great environment. Their parents are doing all of the things that they're supposed to be doing. They've gone to therapies for, years, and just why isn't this happening for them? So that's kind of how I got my feet wet, if you will, in the world of reflex integration.
And now to my second question is
Uh,
why why do you think as a speech and language there are so many children who are struggling, nonverbal kids and so on?
So when you think about the developmental pyramid, reflex integration is here at the foundation. And then all the way at the tippy top are things like speech and language. They're really high level cognitive functions that require a lot of executive functioning skills. So it's really complex to tease apart why a child may or may not be speaking, but I have some, really kind of big ideas of what the general reasons could be. Of course, each kiddo that we work with is going to have their own, specific individual needs, if you will. But just kind of in a general sense, when we're talking about just speech production, like the actual just production of speech sounds, using the mouth to create a sound, we're talking about mostly the left hemisphere. So we're talking about the processing of those speech sounds and the execution of those and the planning of those speech movements. But there's something that happens so much further before that starts to happen, and that's the development of the right hemisphere. So the right hemisphere, as you know, and as I've come to learn, is responsible for all of those nonverbal communication skills that we build our verbal communication on. So, things like paying attention to body language, things like paying attention to tone of voice, facial expression, posture, gestures, joint attention. These are all nonverbal communication skills, and they are all predominantly regulated by that right hemisphere of the brain. And we know that in the first, 3 years of life, that's when that hemisphere is really the predominant focus of the brain and development. We know that everything's kind of developing, but that right hemisphere is really a big focus in that first 3 years. So if children are unable to navigate or develop those nonverbal communication skills, it's going to be really difficult for them to navigate mapping, if you will, those verbal communication skills on top of those. But even going a little deeper, I found that, in working with kiddos that I work with now in speech and language, when I do an assessment, I look at things like proprioception. And so proprioception is just huge in, in the development of speech and language. A lot of children who are nonverbal and autistic really have a big deficit in their right hemisphere because they have those issues with those nonverbal communication skills. And that's actually one of the DSM-5 criteria for diagnosing autism, because it is a social communication issue. So there's obviously other criteria and other symptoms that have to be seen across settings and certain frequencies. But, it's that social communication piece that really starts to trigger those thoughts around whether or not a child could be autistic. And so for that, those nonverbal communication skills to develop, we also know there's something deeper. So we have to start thinking about proprioception and interoception. So kids who have poor proprioception and poor interoception. So interoception being how we feel the sensations of our own body, like how we feel, like how does it feel when we're angry? How does it feel when we're hungry? How does it feel when we're tired? And do we recognize what those signals in our body actually mean? Do we pair them with a meaning? But also that proprioception piece of, knowing where your body is in space. So thinking about knowing where your teeth, your tongue, your lips, your jaw, all of that, your soft and hard palate, where they are in your oral structure, but then also like what your body parts are doing at any given time. So like how they're moving to create speech sounds, or how they're moving to create a smile or a frown, like being aware of where your body is in space and what your body is doing at any given time. So that leads me to really want to talk about something that I've been studying in a course that I've been taking by an amazing therapist. Her name's Tara Sumter, and she's been teaching on executive functioning skills. So, two of the foundational skills fundamental to developing speech and language are perception and attention. So, perception, as she describes it, is really being able to perceive your environment. So, all of the sensory information that's coming into your environment, people, places, everything in your environment, being able to perceive your environment accurately, but then also being able to perceive yourself. So that's where that perception and that proprioception and interoception come in,
Yeah.
and that perception piece. And perception is really the most foundational level of executive functioning. It's really the furthest down in that development of executive functionings. And without perception, then you're not accurately engaging in the second executive functioning skill of attention. So you're not accurately giving a sustained perception, if you will. That's how she kind of describes attention, is being able to stay in a state of sustained perception of a sensory stimuli. So whatever that might be, whether it's a kitten running across your living room or whether it's a smell coming through your kitchen, being able to perceive that for long enough and give it enough attention that now your brain can start to create meaning around it. And that's where we get into something called working memory, verbal and nonverbal working memory. These are again, two of the foundational executive functioning skills. So, verbal working memory being how we hear sounds and process sounds, and that's predominantly in our left hemisphere. But the nonverbal working memory is how we create mental maps or mental schemas of the sensory stimuli that we're actually experiencing. So, if you think about a child who has difficulty processing sensory information, whether they're hyposensitive or hypersensitive, then they're going to have a real problem being able to perceive rightly other important information that's coming in to their environment, like maybe a mom that's trying to model a word for them, or a brother or sister that's trying to play with them and model how to play with a toy, or how to interact with a peer at school. So all of these foundational executive functioning skills are really important to the development of speech and language in a child who is nonverbal. So we know that kiddos who have a weaker right hemisphere of their brain are going to have those issues with nonverbal communication. They're going to have issues with proprioception and interoception, and therefore they're going to have issues with executive functioning skills required to develop speech and language, which are perception and attention and verbal and nonverbal working memory, being able to use those to map language onto, if you will, and have functional verbal exchanges.
Many of the families who contact us ask us if the Melillo method can help with the Gestalt language.
Mhm.
So can
Mhm.
you just briefly explain what it is and how can we help?
There's two basic theories of how we develop language. One is the analytical language processing, and that's what most of us are familiar with. Babies are engaged in a sensory experience in their environment. They pay attention to their mom or their dad making sounds in their face and pairing it with an item to create a meaning, and they start trying to imitate that. So they start trying to babble and then speak their first word, and then they start combining those words to make phrases and sentences and eventually conversation. So that's a really linear way of thinking about language development. But Gestalt language processing is where a child begins to hear language in chunks, where everything that they say is actually one thought and conveys one meaning, if that makes sense. So they start to learn language and use language in these chunks or scripts or gestalts. And then later on, they can learn how to break them down and then be able to use words from that gestalt to create new phrases and new sentences and new conversations. So it's a little bit of a process working from gestalt language. It's almost like you're working to analytical language and then you're building up again. So that's kind of like the two theories. But I need to say that Gestalt language processing is a normal part of language development. So even though it seems like it's not, what makes it seem um, different or deviant from what we would consider possibly as typical is that children often who are Gestalt language processors get stuck in that stage. So Gestalt language processing used to be called things like immediate echolalia, delayed echolalia. We heard these terms used for kiddos who use Gestalt language processing. Well, we see that even in typical development. We see children do that. When they hear something, they repeat it and then they practice it over and over and over again, sometimes ad nauseum because they find a phrase or a word that they really like. But the difference is they kind of move through that phase more quickly and then into more of the analytical language development instead of getting stuck there. And so all Gestalt language processors are not autistic, and all autistics are not Gestalt language processors, but there is a high percentage of children who are autistic who are Gestalt language processors. And something that parents and professionals need to know is that these gestalts actually have meaning, but they're typically not literal. So that leads me to some of the kind of wonderings that I've been having, like in my own therapy and my own interaction with children who are Gestalt language processors. So I'm loving all of the treatment methods and strategies that are coming out of the speech language world on how to work top down with these kiddos. But I started thinking about, as I was learning about verbal working memory and nonverbal working memory, verbal working memory is literally just the sounds or just a word. So one example that I could give is you might know this word, I don't know, but I think it's a Norwegian word, but it's draga. So this is an example that was given to us in this training that I was taking. And the lady said, draga, can you say that back? We all said draga. So our verbal working memory is working great, but we have no nonverbal picture of what
Yeah.
that means because we don't have a semantic map for that. So that's just kind of an example of what makes me wonder if our kiddos who are autistic and who are Gestalt language processors using a lot of scripts and a lot of echolalia to communicate. And it's not literal. So the words that they're saying are not actually conveying the meaning that they're meaning. So, example, I had this little boy who would say, want to go on an airplane? And I was like, wait, where are we going? Are we going on a trip? And I was like talking to his mom, trying to find out, are you guys going on an airplane? Did you guys just go on an airplane? And thankfully, she had done the detective work. So she knew what want to go on an airplane meant. And it did not mean what the words would literally convey. It meant he wanted to watch a show, a specific cartoon that he loved, where the characters got in an airplane at the beginning of the show
Yeah.
and they took off. So those gestalts are not literal. So it makes me wonder again if we have a case of this high functioning left hemisphere that's hearing all of these speech sounds and they're creating these sentences or they're using phrases and scripts that they've heard and they've connected them to some kind of strong meaning, something that felt good, something that made them happy or sad or angry. I had another little boy that every time he would get hurt, he would say, "Are you okay? Are you okay?" And it's because that's what he heard his mom say, or that's what he heard his teacher say, "Are you okay?" So he was repeating back that phrase, and that's not what he meant. He meant, "I'm not okay, I'm hurt." That's what he meant. And so it I really do believe that the Melillo method and, working on reflex integration, working on balancing the two hemispheres of the brain, strengthening that right hemisphere, is going to allow these children who are Gestalt language processors to, again, those two really important executive functions, to perceive and attend for long enough to the stimuli coming in that they can create those nonverbal maps in their head. So then they can pair the verbal information with those pictures, and then they can kind of go hand in hand, being able to convey a more literal meaning versus a Gestalt that can sometimes be extremely difficult to figure out what it actually means. So I do believe that kiddos who are Gestalt language processors have a higher left hemisphere. And so we really need to work to bring up that right hemisphere, make it stronger, work on integrating those two hemispheres, which is what we do in the Melillo method, and working on balancing the brain.
Uh-huh.
Yeah.
And how has your work changed with working with nonverbal autistic children since you incorporated other modalities in your work?
Wow. Like completely different directions. So I've been working with families who have children. I have one little boy who is just totally a Gestalt language processor, and he's so much fun. And I've had him for about a year, but working with the family and supporting them, we have not targeted specifically speech and language development. We have only targeted strengthening that, you know, um, integrating the primitive reflexes and strengthening the right hemisphere of the brain. And his mom is beginning to text me saying, "You would not believe that he just asked me this
Wow.
question, and it's exactly what he meant." Or she'll text me and say, "We were with family the other day, and our whole family was so shocked because he just came out with this spontaneous, sentence that meant exactly what he was trying to convey." And so, and then I have another little guy who is a Gestalt language processor, but he had a very traumatic early childhood. He was trached for a couple of years. He's adopted into the family that he's in now, and there was just a lot of trauma around his first 3 years of life. And so when I met this family, I could hardly understand what he was trying to say to me. He was trying to say a lot of things, but his proprioception was poor, his cerebellar function was poor, and rhythm and timing and execution of motor movements. His sensory perception and processing was poor. His reflexes were all retained, so we had to work on them. And so I've been working with this family for about a year as well, and I literally just got a text from his mom. Also, he was not eating. He was only eating puree textures, and he was not chewing. And his mom would have to make him special meals because that's not what the family ate. And so, not maybe a month or two ago, I got a text from her saying that he's now eating his brother's food off of his plate.
Oh,
She's no longer,
wow.
yeah, she's no longer having to make him his special meals. He's chewing, he's taking different textures, he's eating with the family. What used to take 2 hours for him to eat is taking very little time. But she said that his speech is just increasingly getting clearer and clearer and clearer, and that she's understanding about 95% of what he's saying now. And
Wow.
so my practice as a speech language pathologist, my thought of just, what I should be doing as a speech language pathologist has radically changed. Before, if a child would come in, I would be doing, just a battery of speech and language tests, an oral motor assessment, maybe some checklists or questionnaires from the parent, an interview, with the parent. Now the first thing I would do is assess primitive reflexes, assess, cerebellar function, vestibular and visual function, because we know that all of those things play into proprioception, play into interoception, and then impact the way that that right hemisphere is able to develop and do all those things that we talked about in the beginning that are important for the development of speech and language, functionally. So
Oh.
very
And
different.
Angela, how can families contact you?
Well, I have an Instagram page. It's at hope underscore unlocked. And then I also have an email through my company, Foundations Learning Services, and that is A Clark at foundationsls.com. So those are probably the two best ways to contact me.
Angela, thank
Perfect.
you so much. I always learn so much from you, and I'm always thrilled to talk to
Thank
you.
you. Thank you. It was fun. Thanks, Dana. I appreciate it.